There it goes. Okay. Happy Friday, everyone. Danielle, Thrive Moms here. We're so excited to be back in the Montvale Pediatrician's office with our incredible APN, Susan. We are going to talk today about COVID, RSV, and flu, and all those fun things, and the most commonly asked questions and concerns that you all might have. So take it away.
Hello, everybody. In the fall and winter months, October to March, pediatric providers see a big increase in viral illnesses. When a baby or child is ill, it can be challenging for parents to determine the culprit. Last year, we had a triple endemic, the circulating mix of COVID-19, influenza virus, and respiratory syncytial virus. The mix of these three viral illnesses is challenging for all because they cause similar symptoms in many cases, but there are some differences that set them apart, which I'll try to highlight today. I have some questions that I commonly face with parents that I'm going to review. The first question is, how does flu affect children? And children consistently have the highest rate of influenza in the community during seasonal influenza epidemics. People at high risk of flu complications include young children, adults 65 years of age and older, pregnant women, and people with certain medical conditions such as asthma, diabetes, and heart disease. The other question that is commonly posed to me is, what are the symptoms of flu? The symptoms are sudden, and on the very first day, it's not uncommon to have fever, runny nose, chills, cough, sore throats, headache, vomiting, diarrhea, fatigue with muscle and body aches. Sudden onset of illness, higher fever curves in the first few days, and body aches are, to me, the giveaways of the symptoms that point providers in the direction of diagnosing flu illnesses. And now, how is flu spread? Another common question. The flu is spread by respiratory droplets and can also be transmitted by touching surfaces and then touching your face. People with the flu are most contagious within the first 3 days to 4 days of the illness. Hand washing is essential, and getting the flu vaccine every year. Both are very effective preventative measures. What is the recommended treatment for the flu? Well, currently, antipyretics are kind of the standard. Antipyretics such as acetaminophen and ibuprofen for children 6 months or older help manage fever and body aches. Maintaining hydration and offering fluids is essential, along with monitoring your young one for worsening symptoms such as difficulty breathing, fever curve lasting longer than 5 days, and dehydration. Antiviral treatments such as Stelmavir, Tamiflu, which is an antiviral agent. This agent can make the illness milder and shorten the time of the illness overall, and may also prevent serious flu complications such as pneumonia, and when treatment is started early. It is important to note that influenza vaccination annually and prior to the winter months is particularly important to reduce the burden of the respiratory illness and hospitalization and preserve the capacity of the healthcare infrastructure. Reducing influenza virus transmission among children decreases the burden of childhood influenza and transmission of influenza virus to household contacts and community members of all ages. The other illness that we're going to touch upon is COVID-19. COVID-19 illness is still circulating. The symptoms are common cold symptoms such as flu-like symptoms, including fever, chills, cough, body aches, sore throat, congestion, runny nose, fatigue, and headaches, and sometimes conjunctivitis. Some additional symptoms of COVID-19 that are more characteristic of COVID-19 are sore throat, loss of taste and smell, fatigue, brain fog, and shortness of breath, and conjunctivitis. What do we monitor with COVID illness? I advise parents to focus on their child's breathing by lifting their shirts and looking at them breathe. Look at the quality of their breathing, how many breaths they're taking per minute, and is it relaxed or is it fast with increased work of breathing? Meaning, is their chest tightening or their rib cage sucking in? With COVID illness, it is also important to monitor your child's fever curve and fluid intake. When children have fevers, this increases their fluid needs, so it's important to keep them hydrated. If your child's having persistent fevers, lethargy, difficulty breathing, not drinking, not wetting diapers, or decreased urination, this warrants a call to the pediatrician's office and may require ER follow-up if symptoms continue to get worse. If your child is sick, parents can utilize home rapid test. Testing family members for COVID symptoms helps to distinguish the virus from other viral illnesses. I often recommend performing 3 consecutive days of testing for COVID or a PCR test when a family member is having symptoms or if there is a history of exposure to COVID. If your little one is sick with COVID and you are seeking advice, it is best to call the pediatrician, as they may be able to perform a phone encounter, a telemed visit, or if need be, see you in the office with your child. I advise alerting the pediatrician's office first, letting them know what's going on with your child and their exposure, and masking your child when they enter the office so they're not putting anybody at risk with their COVID symptoms. How do we prevent COVID-19? Well, we prevent COVID-19 by staying up to date on our COVID vaccines, improving ventilation in indoor spaces, rapid or PCR testing for COVID when we have symptoms, staying home and following isolation precautions when symptoms arise, and avoiding contact with people who may be infected with COVID. Next, we're going to talk and mention respiratory syncytial virus, RSV. Respiratory syncytial virus can cause the same basic symptoms as a common cold, flu, or COVID-19, such as runny nose, cough, sneezing, and fever. Other symptoms of this virus, such as wheezing and intense rhinorrhea and coughing episodes, are more of the hallmark symptoms of RSV. I will often tell parents the cough, irritability, and fussiness with decrease in appetite often help to differentiate it from other conditions. The cough is distinctive, and often children may have intense periods of coughing and a cough so hard that they may vomit. RSV patients, especially infants, can become short of breath and may suffer a high fever. The mucus and the inflammation may partially or completely block the airways, which causes wheezing, a whistling sound that we'll hear with a stethoscope when we're examining a child. It will also cause a decrease in PO intake or drinking and eating and appetite. Difficult breathing often prompts visits to the pediatrician's office or ER. Hospitalization may also be necessary if the infant is experiencing intense dehydration or trouble breathing. What is bronchiolitis and how does RSV affect the lungs? These are 2 other questions I'm commonly hearing. RSV is the most common cause of bronchiolitis. RSV first affects the upper airway, nose, mouth, throat, and spreads its way down the trachea into the bronchial area. With RSV bronchiolitis, high temp, dry and persistent cough, difficulty breathing, rapid or noisy breathing leading to potential wheezing often occurs. Bronchiolitis is a lower respiratory infection affecting babies and young children under the age of 2, most commonly. Babies aged 3 to 6 months are at greater risk of illness and more likely to develop bronchiolitis. Bronchioles are small air sacs or small airways in the lungs that are less than 2 millimeters in diameter. So you can understand that when children are affected by RSV, how this can provoke difficulty with breathing at times. What is the treatment for RSV? Fluids, Pedialyte, antipyretics such as acetaminophen and ibuprofen, steam treatments, exposing that child to humidified air, humidifier machines, suctioning out their nose so they can breathe easier and find feeding easier, monitoring for difficulty breathing, nasal flaring, the chest retracting, and also important to lift their shirt up and watch them breathe and make sure they're breathing comfortably. Monitoring their urine or diaper output is important. Parents should have a plan of care with their provider if they've been diagnosed with RSV. I often say it's wise to engage in frequent check-in phone calls, telemeds, or appointments to make sure your child is stable with this illness. At Montvale General Peds, we encourage parents to return to the office for recheck as needed if they have RSV. We want to avoid any hesitation in communication with parents, and we often want the child to come back to make sure that the illness is not causing any severity and that the child is remaining stable. It also provides an opportunity for parents to engage in additional questions and educate, and allows us to educate them and provide them the support that they often need when a child has an RSV illness. It's also very important to note that if RSV becomes more intense and breathing and fluid intake is challenging, they need to speak with their pediatrician, their healthcare provider, and alert them to the status of their child. Sometimes children will need oxygen support if their oxygen levels are low, and often IV fluids to support them and keep them hydrated, and frequent suctioning of their nose while they're in the hospital and mouth to aid with their breathing and to help their feedings progress. Are medications necessary for RSV? Also a common question that I hear. RSV is a viral illness, so antibiotics are not required unless a secondary illness such as pneumonia or otitis media occurs. And is there a vaccine for RSV? Yes, there is. Over the course of the summer, the FDA started to announce approval for vaccines for women who are pregnant 32 to 36 weeks, young babies, and adults 60 years old and greater. So we are excited about these vaccines as they will likely help protect these populations from RSV and help aid to reduce the incidence of RSV.
That was so much incredible information. I love it. So I had so many questions, but you answered every single one. I'm trying to think. If anybody else has questions, throw them in. I did have one question that popped into my head and is now gone. Oh, so say I'm a mom, say I'm home, say I'm a new mom. It's my first time. I don't have a nurse in my family. Would you always recommend it, when in doubt, to just call the office and say, can I speak to a nurse on staff? Is that okay? Is that annoying when we do that? I feel like I want to hear that.
Not at all. Especially, well, in general, you should always call and err on the side of getting information and educating yourself and optimizing the care of your child. But one of the things I always stress to parents is during this viral illness season from October to March, children are getting sick and then often sick again and having back-to-back illnesses. And sometimes when you hesitate to seek the information that you need, you're not optimizing the care of your child. So I often say it's better that you call. It's also wise to let the staff know that it's not an emergency and you can get a call back at any time during the day, or if it is indeed an emergency. The one thing I will stress to parents when they call, if your child is sick and seems like they're not getting better, I think it's best just to make an appointment. Sometimes you hesitate to make an appointment. I think it's best just to go ahead and make the appointment, because sometimes if you hesitate and you're not sure and you call later in the evening, you don't always get the appointment that you're hoping to get. It's sort of more difficult and challenging for staff to fit you in. So I always say call early. Don't be shy. Pediatricians and nurse practitioners, they want to answer your questions and they want to work with you to get your child feeling better.
Thank you. I'm the queen of waiting and then regretting it, folks. So don't be me. My background is nutrition, and I'm like, oh, let's just try natural remedies. And I need you to tell us that that's probably not ideal. I'm all about, me and my kids, especially this time of year, we do honey spoons every morning. Everybody gets a spoon of honey. And I do over-the-counter medication as well. But can you talk a little bit about like just staying comfortable, prevention at home? Is honey really helping us? I'm going to keep doing it.
So honey in a child older than one is totally fine and is helpful. I often say some teas like chamomile tea, jasmine tea, green teas, as long as they don't have caffeine, they are helpful as well. homeopathic measures like putting a little eucalyptus oil in the bathtub and having them breathe in some steam from running the shower or running the bath acts as like a vaporizer and helps them breathe more easily. I often tell parents, and this sort of goes against the grain, that if your child's sick but stable and they're having some congestion, sometimes going outside and just breathing the humidified air outside and going for a walk and getting some fresh air is helpful and aids them with their breathing and their stuffy nose. I'm a big believer in homeopathic methods to help aid us and help move us along in our illness. And sometimes when we're not so sick, just going out, I often would tell children that were faced with COVID-19 illness that if they're stable and they're not at risk to expose themselves to anybody, to go for a bike ride, to go for a scooter ride, to get outside and to get some fresh air is totally appropriate and helpful. When children are recovering from their illness, they need to go outside and get a little light exercise and get some fresh air to help move their day along and help them recover from the illness. And I think from a mental health point of view, it's not a bad idea to get outside and get a little fresh air when we're faced with some of these illnesses and we're stable and we're not exhausted or dehydrated.
Awesome. I love that you said that, because my kid, we're like trying not to get my kids outside when they're not feeling well. So it's nice to hear that we're doing the right thing getting outside.
Absolutely.
So thank you so much. This has been so informative. If anybody has questions, if anyone wants to come visit the practice in Montvale, you know how to get in touch with me. I can get you in touch with our practitioners. And happy Friday.
Thank you, everybody. Happy Thanksgiving.
Oh, yeah, happy Thanksgiving. Thank you.